Okay, today's class is on infertility. So, what is infertility? It is defined as a failure to conceive after 1 year of unprotected sexual intercourse. And there are two types, primary and secondary. So, it is a primary infertility is the inability to conceive in a couple who had no prior pregnancies. And secondary infertility is the inability to conceive in a couple who had at least one prior conception which ended in a stillbirth, abortion, or ectopic. That's a previous pregnancy is there, but it did not. It was not successful. That is secondary infertility. What are the causes of infertility? 30% cases it is male factor, and 40 to 45% it is female factor. And the female factors are ovulatory dysfunction, tubal factors, uterine factors, cervical and peritoneal factors. Both male and female will contribute to 10 to 20% cases. And in 10% cases, we cannot find a cause. They are called unexplained infertility. So coming to the female factors of infertility, one most common is ovulatory dysfunction. This can occur in pituitary disorders, and as well as the commonest condition is polycystic ovarian disease. Then there is a hypergonadotrophic hypogonadism, that is Turner's syndrome. Then another cause of ovulatory dysfunction is hyperprolactinemia, where the patient will present with galactorrhea. The tubal factors, that is a block in the fallopian tubes. The commonest cause of a fallopian tube block is pelvic inflammatory disease. Then ectopic pregnancy, endometriosis, history of previous pelvic surgery, and the tubal factors evaluated by the various tubal patency test, like a hydrotubation, hysterosalpingogram, that is we will inject a dye into the cervix and we take x-rays so that we can visualize the uterus and the fallopian tube, and also by laparoscopic chromoperturbation. The same thing we are injecting and we are observing the tubes under laparoscope. And what are the uterine factors? It's mainly due to congenital anomalies of the uterus and acute abnormalities like endometrial polyp, Asherman syndrome, submucous fibroids. And there are peritoneal factors of infertility, that is adhesions, which produce tubal obstruction, as well as in endometriosis and pelvic inflammatory disease. Male factor infertility, the main causes are hypothalamic causes and pituitary causes, which affect the spermatogenesis. Then testicular causes like a chromosomal disorder like a Klinefelter syndrome. But these are not much correctable